There is your right. So if you have read and understood considering the communication skills question, kindly begin.
Hello, good afternoon, sir. Am I on to the
Good afternoon.
am I on to the consultant on call?
Yes, yes.
Thank you. This is Dr. Abdul. I'm one of the SHO on call. I have with me one of your patients who had mastectomy done 2 days ago and now has developed axillary swelling. And her daughter has insisted that she wants to take her home. Currently, this woman, as you know, has background COPD and mild left ventricular failure. I've tried to convince her in the last 20 minutes, but she insisted that she wants to take her mother home. And that's why I've called you, sir.
Okay. So you said she had axillary swelling?
Yes. Today is
anything else?
Yeah, today is the second day post-op, and she developed axillary swelling and also has shortness of breath.
Okay. What do you think? Why do you think she's having shortness of breath?
Yeah, because the mastectomy involved clearance of the axilla, so I'm thinking maybe there is, and also because of a background condition, there could be some form of pulmonary embolism, maybe. Yes.
Okay. So you said her daughter had wants her to take home, right? Do you think the patient made her own decision?
Come again?
Do you think that the patient made her own decision to go home?
No, I think the patient is currently weak, and I think the decision is made by the daughter that she just insisted that she wants to take her home, and I don't think the patient is in the right state to leave the hospital because of her current state.
So does it mean the patient is not alert enough to make decision?
Yeah, well, with the current condition of the patient and a current clinical condition, I don't think the patient can make a right decision for herself at the moment. But I think because of the current state, the patient should remain in the hospital. So,
okay. Did you talk to the patient yourself? Did you check on her?
I've examined this patient, and that's why I saw that this patient has axillary swelling. I also noted that she has shortness of breath, and I don't want to worsen her current condition. And I've tried to discuss her current state with her daughter, who wants to take her home.
So it is more of the daughter's decision than the patient's decision, right? Okay. So, she had axillary swelling and shortness of breath. So you already said. So what do you want to do about her now?
I've tried to, I want to discuss with you before I do anything, and also if you like to come to the hospital to review this patient, as the fragile elderly lady and needs a very specialist input. But what I would like to do is to urgently do a CT, a CT that will show whether we're actually dealing with the pulmonary embolism or not. Then also start the patient on anticoagulant as soon as possible. Also,
so if there's bleeding, you don't want to do anything else?
Come again?
If there's bleeding. You don't want to check anything else?
No, you said bleeding?
Yes.
Yes.
I want to take blood samples to check our hemoglobin and see if the patient will need blood transfusion. I want to start her on fluid right now. I want to put her on oxygen because she has shortness of breath. Then there's axillary swelling. I want to ensure that the limbs are elevated, and also want to nurse her head up.
How would you explain the possible complications to the patient or to her daughter?
Yes, because of the nature of the surgery, it's possible that some structures in the axilla were injured, because that area has a lot of delicate structures, including axillary vessels, which might be injured. And also, even the mastectomy itself may also lead to secondary hemorrhage, seroma, and all that. That can also cause the shortening of breath from anemia. Another thing is the shortening of breath can also be due to pulmonary embolism, like I said, because of background comorbidities.
And what would be the thing that you would be concerned most if you want to discharge this patient?
This patient currently is not in the right state to be discharged because she is not stable clinically. So before I discharge
okay. And when will you ask her daughter to bring her back in case they insist on taking her home?
I won't allow the daughter to take the mother home in this state because this patient is not clinically stable. That's why I want you here and probably talk to the daughter or have somebody involved, because I don't think the daughter should go home, the mother should go home, despite her daughter insisting.
But you have already tried that for last 20 minutes.
Yes, I want a senior person to also talk to them. And probably if you can involve somebody in the hospital, maybe legal, because there's not a patient making decision herself.
In case you want to in case you have to discharge her against the medical advice, what will you do about the drain?
The patient will have to go home with a drain if I'm discharging the patient.
And who is going
I want
to
them to? Yeah, the patient. I just want them to observe the breast and see that the dressing over the operative site is not swollen and that the drain is functional. That will tell us that the drain is not blocked and there's no collection of hematoma or something beneath the skin flaps. Then we can also put a call to them and know what's the chart like in terms of what is coming out in the drain, and also give us symptoms and signs to look out that we suggest anemia, like drowsiness, dizziness, feeling of weakness, and all
that. Okay, time bank. Dr. Karma, can you give feedback?
Thank you.
Thank you.
Thank you, Dr. Abdul Razak. I think he covered most of the things he tried to answer. Yes. Few things maybe he could be like improve. Specific.
Yes.
Yeah, like here is it did mention fragile. When I asked him like whether he checked on the patient, he was like mentioning about the examination part. I was expecting whether he really talked to the patient, how is her, cognition, how is
yes.
her, yes, mental status, whether she is alert or whether she is competent enough to make decision,
Yes.
because that is what I expected him to say, because that is the most that's the important thing we are concerned about, because the daughter is wanting her to take her home, and if the patient is fragile or like what he mentioned, that patient cannot make decision, then that would be a different thing. That would be totally the daughter's decision.
Yes.
And the rest,
I think
CT
yes.
pulmonary angiogram.
Yes, you said CT. It was CTA. Yes. Yes, Dr. Dama, continue please.
And when I asked like who would take care of this if he wants to discharge her with the drain, who will take care of her at home? He can say that he will assign someone, or call her GP to make home visits and all.
GP and social services, because they will go and they will do
That's all.
Just one finding that and there is just shortness of breath. How can we communicate? Hello, can I speak?
Yes.
Yes, I'm sorry, I got disconnected.
So in case we need to communicate with a senior, usually we follow the routine of SBAR, situation, background, assessment, and response. So wouldn't it would be better if we go through this way?
I'm sorry, I was disconnected. I didn't hear your question.
Yeah, I think you said you asked that we should have gone through the SBAR situation, background assessment. I think that's what we actually went through, and he started asking questions. The situation is that the patient has had mastectomy 2 days ago and now has axillary swelling and shortness of breath, and the daughter wants to take her home. And the background is that she has comorbidities, the COPD and left ventricular failure. And what you think, and the assessment, what you think this patient has, you think he has pulmonary embolism, or you think he has post-operative anemia or something. And he asked me,
or DVT.
Or DVT, yeah. And he asked me what I was going to do.
Needed to ask, can we make up some findings from ourselves, or we just have to keep ourselves to those which are?
You can't. Nothing from yourself. If because you know how communication skills stations are carried out, you'll be given 9 minutes and you'll be sent in a room with a file on the table. You'll pick the file, you'll make your own notes, and you'll prepare for 9 minutes. And they will not be in the order. Once you'll make your notes, you would have to make sure that you write the dates in the order, because nothing will be in the order. And then in the next door, you'll go and you'll call the consultant and you'll carry out the.
Okay. Thank you, ma'am.
And here, if something is not written in the notes, you can't make it up. Like just post consultant will ask you if patient has undergone any complication during the surgery. So in the notes, it's written there was no complications. But then if consultant asks you, yes, please.
That's exactly my question. Even the vitals are not mentioned in this. So can we cannot mention them, right?
Vitals are not mentioned, but it is written that there were no complications during the surgery, and then there was minimal blood loss. So if a consultant asks you on the phone if patient has had large massive blood loss, then you can say no, minimal blood loss patient has had. Patient asks you about the consultant asks you about the vitals, you say since there was no complication during the procedure, so I suppose, but then you cannot mention the vitals. You can say, okay, I'll check and I'll get back.
Okay.
Whatever is not mentioned, you cannot make
it.
up, and you cannot say, just say, okay, I'll check and I'll get back to you. And you can ask, do you want me to get back to you right away or later? Whatever, like in a natural way, you have to handle it. Like this. These communication skills.
Thank you, ma'am. Thank you.
Dr.
I think I had the same I think I had the same issue when Dr. Kama was asking me,
Yeah.
have you seen this patient? Like, have you seen? So I just tried to look at what was available. So I think maybe I should have also thought that the patient is fragile, it's there. Then I tried to see, I've examined the patient and I mentioned only axillary swelling and shortness of breath. I didn't talk about vital because it's not stated. So I don't know if that answers the question a bit. Even if you have maybe one or two findings, just say you're saying, and that's what you found. Like if they ask for other things, tell them you check it.
Yeah, but whatever is not written there, you cannot say it. If it was not in the preparation day, it was not in the patient notes, in the patient's journal, you cannot mention it. You cannot make it up. You cannot make it up and say it. That will be a crime. They'll fail you because they already know the answers. So never ever do that. Good, thank you.
Thank you. Thank you, Doctor.
Started your timer and here is your question.